thank you, Brian, for that very nice introduction and really beginning to this conference, which is a great time for a lot of people working in the industry to get together. It's great to see everyone after 2 years of not being able to do that. And we do have a great program today, and it's wonderful to start it off with Glen Tullman, CEO of Transcarent. Thank you, Glen, for joining us. Most of you know Glen's background, and he really has done so much in the industry already, and I think there's much more to be done, and we're going to hear about that today. But starting with Allscripts, where he was CEO back when electronic health records were, not really common. More recently, the CEO of Livongo, really one of the first chronic care digital health companies that Glen took really from conception to a very successful company that was able to IPO. So someone who knows a little bit about not only the healthcare industry, but starting companies, building companies, creating value, and really doing what Brian was saying in terms of adding benefit to the healthcare system. So I want to start, Glen, by asking you a little more about Transcarent, which I think how it started, what your goals are. You had just left Livongo. You could have just gone golfing or sailing, and out of the blue, you create Transcarent. So tell us a little bit about how that came to be.
Sure. Well, first of all, it's great to be here today, and Rick, it's great to see you again after some time. Rick didn't mention it, but early on, as we were trying to figure out whether what we could do at Transcarent was actually legal, we called on your expertise, and you told us it was. So I'm not wearing a striped shirt today. I hope it remains that way. Transcarent, the idea behind Transcarent was to create a new, different, and better health and care experience that actually puts people back in charge of their care and is aligned with the people who pay for care. And the people who pay for care are increasingly all of us and the companies we work for and the government. If we step back just a moment, Transcarent was really informed by my experience at Livongo. And Rick mentioned Livongo. Livongo was focused on empowering people with chronic conditions like diabetes to stay healthier. And we did that using a lot of technology, connected technology, a lot of data science, and actually put people in charge of their care. And what we found was three things. When you did that, people didn't just like it, they actually loved it. We were able to demonstrate better clinical results. We could actually show populations became healthier. And last but not least, we did it at a lower cost. So kind of the trifecta in healthcare. And that's, I believe why there was so much value attributed to Livongo. I think when we started off, the goal was, could we get to $1 billion? Could we get to $10 billion? When we sold it for $18.5 billion, after 6 years, a lot of people said it was an overnight success. We didn't think so. There were a lot of overnights, I can tell you, during the process. But that whole process really demonstrated to me that what we're headed toward is a consumer-directed healthcare system. And, as we surveyed, when I left Livongo, we surveyed a lot of different groups of people to try to understand what people were looking for. And if you survey people today, what people say is they find healthcare more confusing, more complex, and more costly than ever before. And they tell you it's getting worse, not better. So think about that, because we've had a long time working on healthcare, a lot of people working on healthcare, and that's the report card, which is pretty bad. And if you ask them to grade it, they say it's a C. So in my house, a C wouldn't cut it. So again, confusing, complex, costly, and getting worse. So what we tried to do was look at that and said, how could we do what we've done in every other industry? And that is create a consumer-directed experience, not a series of products, but an experience that actually empowered people, put them back in charge of their care. And that's what we've been able to do at Transcarent. So Transcarent, it all starts with your phone. You look at your phone, there's no sign-on. You can talk to a doctor in 60 seconds, 24 hours a day. You can schedule appointments with your local health system. And then as you go down the care continuum, you can get meds delivered to your home at the lowest possible cost. And you can get other services at home. If you have to get surgery, you get actual, reliable, dependable, honest evaluations of quality. And last but not least, if you have complex care situations like cancer or the like, we get you to experts who can tell you what to do, and you can trust those experts. So it really puts people back in charge, no different than all the other services that people love. So Uber puts you back in charge of your experience. And I'll just kind of end that with an example. I was with my daughter in Washington, D.C., and we walked out and we were looking to get a taxi. And I said, well, there's a taxi. And she said, no, I'll Uber. I said, but there's a taxi right there. She said, no, I'll Uber. It's just better. And so I said, well, what's better about it? And she said, well, I know who's driving. I know where we're going. I know how close there are. I can tell what kind of vehicle. And I don't have to deal with money. I can just touch it, and it's all done. And so I thought about that experience and thought how far we are in healthcare. And as investors, and I also have a early stage venture capital firm called 7 Wire Ventures, and we manage a few $100 million. And what we look for is any kind of technology that's going to eliminate the middle in a process, because the middle is where the friction is. So if you think of healthcare, what do we need? We need all of us. We're health consumers. And we need the people who deliver care. And that's doctors and nurses and surgeons. And the middle is all friction. And so the goal of Transcarent is how do we take the middle out and go directly to the people who deliver the care? And that's really the goal.
Right. One interesting thing about the model, I think, is that you've approached the consumer through the employer. And I think that allows you to access large numbers of consumers and to have the employer there. Tell me a little bit about that choice as opposed to just marketing to consumers on TV and radio.
Sure. Well, that's really just an economic decision. And again, as investors, you look at how can you most economically launch and access people and have that conversation. And so TV, radio, and increasingly the internet, very expensive ways to find people you want to access. Whereas if we go to large self-insured employers, we can go and find 100,000 people. If you're dealing with Amazon, 1.5 million people. And it's one selling decision. It's one conversation that we have to have. And then 100,000 people get exposed to our services with fundamentally no customer acquisition cost. And that's what really in the internet space and the technology space, you always want to look at customer acquisition cost, because many, many fast growing companies, many of which are not valued very highly today, the CAC, the customer acquisition cost, is actually higher than the revenue, or they don't stay very long. So we like to, and most of our businesses are focused on the employer market or the government market. Government market can take a little longer to access. So there we look at, that's the model for not only for the companies I run, but for most of the companies we invest in.
So speaking about taking out the middle, the insurers have said sort of that was their responsibility to, navigate care for their members, but they haven't really done the job in your view, right? Which is why you're filling that need.
Well, I hope it's not my view. I mean, I would think that if you survey, how many people think your insurance company is doing a wonderful job? Raise your hand. Anybody? Please, one hand. Somebody must be working for an insurance company. So the fact of the matter is no one believes that the existing structure is working well. And now that I want to distinguish between, we have the best doctors and nurses and healthcare organizations in the world. But that middle serves as a block. You know, if you look at the number one cause of bankruptcy in the United States, it's insurance, and it's co-insurance in particular, which people get surgeries, don't realize how much they will owe, and all of a sudden they're bankrupt. And so in that scenario, what we found is we went and we talked to people, and they said the insurers have had 20 years to try to fix it. They couldn't do it. Then we had people said we need innovation. So you had all of these apps come out, and the apps worked, but you know, we had people who had 7 different healthcare apps. And the Wall Street Journal not too long ago published an article, said the average mid-sized to large self-insured employer now has between 18 and 25 different contracts that they're signing to try to provide care to their employees. And yet, as I said before, their employees are still unhappy. So this is, again, it's mushrooming. Then you had a whole nother industry develop called navigators. And the navigators said, we'll help you, we won't fix the mess, we'll help you navigate through the mess. The problem there was they added yet another step, more cost, and no ROI. And so now today the market has once again soured on that. So along comes Transcarent to say we're actually going to not try to navigate a broken system, but to reinvent the system using things like direct contracting and making smart use of technology that's been used in every other major industry in our economy today.
So you're pulling together really the best of, you talk about doctors, hospitals, app makers, and an army of the willing, right? And because there are a lot of entrenched interests among the providers and suppliers too. So you've got to persuade them to join, you know, this cause. Are there particular incentives, or what is the thing that's getting people to join? Because you clearly are making progress on that.
Well, first of all, no one said this is easy. And when we built Livongo, you know, there wasn't anybody who seemed to like it other than the end users. So as an example, we gave away the strips. If you have diabetes, type 1, and in many cases type 2, you have to check your blood sugar. You do that by piercing your finger, getting a little drop of blood, putting it on a strip, and those strips are very expensive. They shouldn't be. So we had this crazy idea at Livongo, what if we gave the strips away free? Wouldn't people be healthier because they wouldn't have to ration the use? We thought that was a good idea, but there were a lot of people making a lot of money from those strips. And they absolutely didn't think it was a good idea, even though it was better for the patients. And so we had a big battle with them. Then the insurance companies and the PBMs were all making money off them as well. So many of us thought those companies were out there with our best interest in mind, but it turned out they had their best interest in mind. So they initially absolutely tried to kill us, and when they couldn't, then they said, okay, if we can't kill you, if everybody really loves what you're doing, then can we at least make money from you? So then they became sellers of our system. So we're facing the same kind of thing today. Now, the difference is that, you know, many of you, no one was brave enough to raise their hand to say they liked insurance companies today. So if I was amongst a group of healthcare professionals and I asked the same question, but I said, how many of you hate the insurance companies? Almost every hand would go up because they have a business practice of not paying for a lot of their bills. So they negotiate a low rate, and then you have to fight for the rate, and then they wait months to pay you. So we came along with, again, a very different idea. And we said, we'll actually pay you in advance for surgeries. And we'll pay you, we'll negotiate a rate, we'll pay you the rate, we'll pay you in advance. And they were astounded that someone would do that and build a partnership. So in places like New York City, the absolute best of the best are the folks we're working with. So HSS, Hospital for Special Surgeries, and Northwell, and Catholic Healthcare of Long Island, and you go down the list. The top providers all want to work with us because the the existing model isn't survivable for them. And that is, every year the insurance company comes and says, we want the lowest possible price. They're not focused on quality. They're not focused on results. And we've kind of turned that model on its head. So we have a very warm reception from the actual providers of care. And I would argue that's who we all ought to care about, because you don't want someone from United Healthcare doing your surgery. You want a surgeon doing your surgery. And so, the folks at United don't love that when I say that, but in fact, that's the case.
Right. Do you think in terms of competitors, I mean, when you looked at this space and created this concept, were there companies out there that either you thought were trying to do this, or are there any now that are doing something similar?
I think there's pieces of this equation, and there's a great saying that says the future is here, it's just not evenly distributed. So we've seen little pieces where this works. The Kaiser model is a model that has a lot of pieces of this right, that gives better consistent care, as an example. But we haven't seen it done at scale in a commercial sense the way we're doing it. And that takes a lot of capital. We take a lot of risk, so we take risk out of the equation for people. And consequently, there's a lot of take-up of the model, just as there was with Livongo, which became the fastest growing digital healthcare company ever. So part of the reason was we made it easy and risk-free to say yes.
Right. So do you think, a United Optum or a CVS Aetna, are they going to come to your door one day soon and say, hey, Glenn, we'd love, we can't beat you, why don't you join us and try to buy Transcarent?
Well, I think, first of all, Transcarent's not for sale. That's not why we're building the company. So we wouldn't have an interest in doing that. And I think that, there's an inherent challenge in some of those companies, like a United, which is their requirement from the market for so much profit. 2 quarters ago, they made $6.6 billion profit in a single quarter, and they had the highest number of individual and system denials in their history. So they denied more care and they made more money. That's not a sustainable, in my view, business, but it makes a lot of money today. So if they called it United Profit rather than United Healthcare, I would love to invest. But it's when they call it United Healthcare and they're not focused on the better health of most of us, that to me is the challenge. That said, I think, look, everybody has an opportunity to get better. I hope that everybody decides to copy many of the things we do. There's plenty of opportunity. There's $3 trillion going to $4 trillion of spend here. It's 20% of the economy today and growing. And so there's enormous opportunity in healthcare. And despite the downturn that we've seen in some of these, the reality is, in part, we were able to get through the pandemic because we had digital health. And it worked at scale. I mean, we went from 5% use of telehealth to 100% in 3 months. And very few systems have been tested like that. And by and large, it worked. Now we're settling in at a more appropriate scale. And someday, maybe 5 years from now, maybe 7 years from now, we won't talk about digital health. We'll talk about health, just like we don't talk about digital banking. My kids don't go to the ATM and say, I'm using digital banking and technology. And, they look at their phone and they do all their banking. And I don't know whether it's good or bad, but my youngest son has never been inside a bank in his life. And so basically he asked me why he would want to go inside a bank. He didn't see any reason to do that. So I think we're going to see that same transition, and this downturn that we're in the middle of, will serve to kind of ferret out the companies that don't have strong business models and make for stronger companies that do.
Right. So, many have said that there's a digital bubble, among those companies, that the valuations got too high, that many of them were, not making any money. Some of them didn't even have a lot of revenue, and that's why it's now pretty tough for some of them. Do you think that there was a bubble there that had to burst, or is that just incorrect?
I guess I would answer that in two ways. So a bubble typically means it's not real. And the fact of the matter is we are watching the digital transformation of this industry. Just as we've seen the digital, it would be like saying, people said years ago, Amazon is a bubble. It's like it's not real, look how much money they're losing. I don't think people would say that today. So that said, there are companies within that digital universe that are absolutely and dramatically overvalued. And they were overvalued privately. Then many of them, other than Livongo, were overvalued publicly. So from that standpoint, I think, but there are going to be very big winners 5 years from now, 10 years from now, just like Amazon. But Amazon, one of the reasons Amazon is entering healthcare is because to grow at the rate they want to grow at, there's no other industry they can do it at their size other than healthcare. And I think, people often talk about big tech is coming to healthcare. Well, big tech's not coming to healthcare. We've heard that, we've seen it many times. I lived, when I built Livongo, out in Silicon Valley. Big tech's not coming. Big customer is coming, and big customer is Walmart, big customer is Amazon. They understand how to create consumer experiences that people love. And those companies, Cheryl Pegas, who now runs Walmart, and full disclosure, we have a business relationship with Walmart as part of our pharmaceutical offering. But she understands what needs to be done, and she's committed to do it. And similarly, Amazon has a great team working on this. So I think we're going to see that. I think Walgreens, Roz Brewer, is doing some very interesting stuff, a multi-billion-dollar acquisition of VillageMD. And, the reality is, I'll get this stat wrong, but there's a Walgreens or CVS within like 3 miles of 80% of Americans. So if you want to talk about a healthcare system that's available and close, that's the place you want to go. They just haven't quite figured it out yet, but they'll get there.
Right. I agree. I think that's right. In terms of just on the digital health companies, there are some that maybe have a good product or service. Do you think this valuation gap and the fact that we're seeing a lot of venture firms and private equity pull back, does that create M&A opportunities for a company like Transcarent that has the money in the bank?
Well, I think my mom always said, when there's a sale, you ought to buy things. And so, that said, right now there are good quality companies. Some are at cash. I mean, they're literally the whole company. The company's being valued for the cash that it has. So I think there are opportunities. I think you have to be careful because there's others that are at cash and should be at cash. And so that's just a function of knowing how you would use those assets and who can use them. And we're fortunate at Transcarent because of our backing that we have that opportunity should we choose to do it. When we built Allscripts, we did more than 20 acquisitions over a 10-plus year period. So we're not averse to acquiring where it makes sense, but you've got to be very careful in doing that.
Okay. So we've established you're a buyer, not a seller.
That's for sure.
And a creator and an innovator. So that's great. I think the other question that raises for me, just the whole digital conversation, is this combination of technology and services, which is sort of, you have to combine those to deliver what you're doing. And what's the mix, would you say, in terms of how much of the solution is technology and how much is service delivery?
Well, I think that it may be the wrong way to think of it as how much is technology, because, again, another quote I like, it sits above my desk, and it says, technology perfectly applied is indistinguishable from magic. And at Livongo, we monitored people remotely, so we knew what was happening in their body. So at any given time, we might call them and say, is there any way we can help? Do you need anything? And they would say, you called at the perfect time, because their blood sugar was dangerously low or dangerously high. Sometimes they were dizzy, sometimes they were truly in need of assistance, but that wasn't magic. That was technology that we were, it was almost embarrassing, because people would say, you called at the perfect time, and you wanted to say, well, you were flashing red on this screen here. That's why we called. And yet, from their standpoint, it wasn't about technology. It was about, we had this amazing experience. It's kind of like if, one of your kids fell and you didn't know if they needed stitches, and randomly the doctor called and said, hey, I just called to check in. You said, wow, perfect timing. Do we need to go to the hospital, or what should we do? And so we can use technology to understand what people need, when they need it, and be better at providing them this experience of care. And that's what we should do. We also can put people back in charge. Again, I'm old enough to remember when you had to call a travel agent to get a paper-based ticket and then pick it up. And I would think it was crazy today if I couldn't, at 12 midnight, go in and book a flight and search for the best flight and the like, because that just makes it more convenient. I don't actually want to talk to anybody for a flight from Chicago to New York. I know the schedule. I don't need to talk to anybody. I don't want any, no matter how nice they are. So I think, again, we have to put people in charge of this. And some people say, well, isn't healthcare too complex? And I would argue that it's not complex at all. If, our job is to make it less and less complex. So scheduling appointment, we do it for everything else, not complex. Finding a specialist, not complex. Finding a high quality doctor, not complex. Understanding what she or what he says, not really complex. And if you need help interpreting that, we should make a resource available that has no financial gain to allow you to get the best advice possible. So I think all these things are what we deserve in healthcare and what we're going to get. And we'll see the existing systems. Some of them, again, I mentioned Hospital for Special Surgeries. I mean, they're doing some amazing things. There's plans that are doing amazing things. Florida Blue, for example, which and their GuideWell subsidiary. I mean, they're doing amazing, innovative things for a plan. So anybody can do this if you start by putting all of us as consumers in charge and respecting them. And then you can choose. You can say, do I want a digital experience? Do I want to talk to somebody? We found, interestingly, that in behavioral health, people would actually rather have a digital experience than they would go and wait in an office and talk to somebody in person like we're doing. Right. They feel like it's less embarrassing, it's easier for them to talk. That's a fascinating finding, because most of us would have assumed the opposite. And we're finding increasingly that people want to text. They don't want a video visit with a doctor, they want to text. And that way they have a record of it, and they know what the doctor said, and it's faster. And we do more text in a day than we do video visits in a year. So that should give us an indication people like to text. And that's what they want to do in healthcare. So I think you've simply got to read and understand what the consumer wants. And that's why folks like Walmart and Amazon are going to be big players in healthcare, because they are really good at knowing what we want.
Right, right. We have an audience of a lot of investors and capital providers. And so, the Livongo story is really an interesting one, how quickly you took that from, a private startup to a public company and a merger. And so interested in how that evolved, that playbook. Is there a playbook, or is it really like hanging around the hoop looking for the opportunities? And is there something that you think was particularly key to that success story?
Yeah, I think, so I've been fortunate to run 4 public companies, take 3 of them public, and So clearly there is a playbook. One, we've seen it not work. You should never go public if you don't have 6 or 8 quarters of knowing what the earnings are in the bag. That would be a silly thing to do, and yet we see companies come out and miss their numbers, which is a crazy thing. The bankers shouldn't have let them go public. They shouldn't have gone public. And, there's basics like that. You need to understand that managing in a public environment is very different. So when I took Livongo public, I wanted to be creative. I wanted to spend my time with customers. So I went out and got an old competitor, an incredible guy named Zane Burke, convinced him to leave Cerner. He was president of Cerner, and come on and be CEO. Zane managed a part of the operations, but we brought on another full-time senior executive to manage the public, and I would still be out with him many times. But, that decision was made very carefully, selecting the right accountants, having all your ducks in a row before, and then just seeing if there's an opportunity. We were fortunate, again, in all of my companies. We've never needed to go public. And frankly, I was always, somewhat, I had mixed feelings about going public because it's harder to grow and manage in a public environment. You've got, we had 70 analysts following us, some crazy number, and every one of them thought apparently they could run the company better than I could, and they would tell me that regularly. And so you just have to be ready if you're going to be in a public environment. But today, going public is a branding event. It creates a currency for you to trade. It creates a valuation basis, to do acquisitions. So there are good reasons to go public. You don't need to do that to get capital anymore. There's too much capital out there right now, and hence SPACs and hence other things that have led to some of these higher valuations. But that's a lack of discipline. And I think even when we raised our last round at Transcarent, so our first round was $10 million about just under 2 years ago, and then we did a round about a year and a half later for $1.6 billion, and that seems like a big jump. But in fact, we had people who came in and said, we'll give you $500 million higher, $1 billion higher. And I had no interest because I said, that's just going to hurt our employees and our ability to recruit. And I want to make sure that our revenue model will be supportable if we at some point decide to go public. There's other companies out there, Hinge Health, $7 billion valuation for a musculoskeletal company. It's a fine company. It's just not worth $7 billion. And now, in this market, their employees are going to get crushed. So that's just a lack of experience. That's somebody saying, I could have a company worth this much. And that's never been the way we run businesses. We run businesses assuming that we may be running them forever. And so we should always assume that's the case. And if we decide to exit or have an exit or a merger makes sense, then we always have that as an option. But you should never do that as a goal. Like when we evaluate companies, we have about 17 we've invested in, I think now. And I always ask the entrepreneur, I say, what's your exit strategy? And if they have one, we almost never invest. I like the ones who say, exit strategy, I love what I do. And those are the folks we like because they're mission driven. They don't have a time frame. They don't say, I'm doing this so I can make a lot of money. They want to solve a problem. And those are the folks we love. So now if they're listening, they'll all say, no, I want to be here forever, and we'll make bad investments. But in fact, those are some of the questions that we ask.
Good. Let me ask you a final question, running out of time here. But just looking at your crystal ball, as you look out, say 3 years, 5 years from now, what will be different in the healthcare system?
I think we're very rapidly moving to a system that is going to be consumer driven. And I think that we're going to focus, we're going to get the quality piece right, and people are going to want to take charge of their care. I think also companies increasingly are going to, particularly in this really challenging environment we're in now, where we're all trying to figure out what do we do in light of COVID? Are we in, you and I talked about this, 3 days a week, the same 3 days, not 3 days? And this is for the group of us that don't have to work in a factory or a supermarket or things where you have to be there. But this is a big challenge. And retaining people, there's a whole generation of very talented people who are making different decisions than some of us made when we were coming up through the ranks. And having flawless health care that's high quality for them and their families is going to be increasingly important. And there's going to be companies that do incredibly well by figuring that out. So, if you think about it, there's a few things that money doesn't matter. And one is taking care of your kids, taking care of your parents, taking care of yourself when there's a healthcare issue. But you need to know that you're getting quality for that. And that's really the same for many companies, which is it's not about the cost of healthcare, it's that they can't justify the cost based on the experience of their people or any other metric. So the only thing they have to measure is the cost going up, but there's no quality metric that's aligned with it. So I think what we're going to see is a consumer-driven healthcare system, a lot more choice, and a reshuffling. If you look at the PBM market, 3 years ago, it was Express Scripts, CVS Caremark, and Optum, which was really an acquisition that they made, owned by United Healthcare. 5 years later, all three of those companies two of the three have been acquired. And who are we talking about? We're talking about GoodRx, we're talking about Capsule, we're talking about PillPack. For God's sakes, Mark Cuban started his own PBM. But why is that? Every one of those companies is focused on the consumer experience. And that's what's going to happen in the payer space. The payer space is 100 times larger. So there's going to be enormous value created. The question is, who do you bet on?
Great. Well, on that note, thank you, Glenn.
Well, thank you.
Please join me in thanking Glenn.